Recording in progress.
Video. एक सेकंड ये मेन करना था जी this spotlight है वीडियो से फिर बात करता है स्टार्ट करते हैं हम लोग स्टार्ट कर
है कमांड आना नहीं उसका
الذين يرثون الفردوس هم فيها خالدون ولقد خلقنا الإنسان من سلالة من طين ثم جعلناه نطفة في قرار مكين ثم خلقنا النطفة علقة فخلقنا العلقة مضغة فخلقنا العلقة مضغة فخلقنا المضغة عظاما فخلقنا العظام فخلقنا المضغة عظاما فكسونا العظام لحما ثم أنشأناه خلقا آخر فتبارك الله أحسن الخالقين ثم إنكم بعد ذلك لميتون. Let's have short translation. Successful indeed are the believers, those who humble themselves in prayers, those who avoid idle talk, those who pray in success, those who guard their chastity, accept their wives or those born moments. But whoever seeks beyond that are transgressors. The believers are also those who are true to their trust and covenants, and those who are properly observants of their prayers. These are the ones who will be awarded paradise as their own they will be there forever. And indeed, we created humankind from an extract of clay, then placed each human as a sperm drop in a secure place. Then we developed a drop into a final clot. Then developed the clot into a lump of flesh. Then developed the lump into bones. Then clotted the bones with flesh. Then we brought it into being a new creation, so blessed in Allah and best of the creators. After that, you will surely die. Sadaqallahu al-Azim.
Moving forward, it's time to pick the best. For that, I request Professor Ikmal Shamim, which will be of Hindu Qabalat Amaraze Niswan, to present the way to each other. Professor, present the way to Professor Ikmal Shamim. Now, I request Professor Abdul Nasir to present the way to Professor Ikmal Shamim. Again, I request Professor Abdul Nasir to present the way to Professor Ashish Khan. Present the way to Professor Rajia Begum.
Sorry.
Thank you, sir. Moving forward, now I invite Professor Shistana ma'am to deliver the welcome speech and share her thoughts on this special occasion. Focused. In the name of Allah, the most beneficent, the most merciful. Assalamu alaikum to all present here, physically as well as virtually. A very warm welcome. I'm honored to welcome you all at this CME, our medical institutions. In OPG, we held in a hybrid mode, allowing participants from all over India to join us in person as well as virtually. First and foremost, I like to extend our heartfelt gratitude and deepest respect to our Chief National Director, Professor Syed Shah sir, who although unable to join us today, has been an eminent source of inspiration and guidance. His visionary leadership, wisdom, and expertise have been instrumental in shaping our institutional growth and success. We are forever indebted to his self contribution and commitment to excellence. We are also privileged to have with us our HR Director of NIU, Professor Abdullah Ansari sir. Your presence is a testament to your commitment to the advancement of medical education and research. I would also like to welcome our organizing committee members, organizing chairperson, Professor Shami, co-chairperson, Professor Vijayanagar, and organizing secretary, Dr. Vasu Fatima. Their times have made this possible, and we are grateful for their dedication. To our distinguished speaker, Dr. Manjunath Swarup and Professor Isma Shami, we are honored to have you to share their expertise with us today. Your insights will undoubtedly enrich our understanding of medical issues in obstetrics and gynecology. Last but not least, I welcome all faculty members, HODs, PG scholars, as well as all participants joining from us from across India for our hybrid mode. We welcome you to this important discussion as your participation is crucial and we look forward to your engagement and contributions. As we all know, medical institutions and obstetrics and gynecology are in rise with 100% annual implications. Crucial factors contributing to this issue include failure to detect internal hemorrhages, delayed diagnosis of communicable defects, undue delay in transferring critical information, and most important, inadequate documentation. The rise in litigation is also contributing to increasing patient expectations, advancement in medical technology, and growing awareness of patient rights. Understanding these medical legal aspects is essential to navigate the complexity of medical practice, ensure optimal patient care, prevent litigations, and maintain the sanctity of the doctor and patient relationship. As we begin this important discussion, I would like to acknowledge the collective expertise and experience that has brought us together today. Last, I would like to express my gratitude to each and every one of you joining us today. I hope this event will provide us with a valuable insight into medical issues in obstetrics and gynecology and equip us with the knowledge and space necessary to navigate this complex issue. Thank you. Thanks, Director Abdul Nasir sir to address the gathering.
Very good afternoon and very warm welcome in this warm afternoon. It's a very warm afternoon outside. You have to see this. I really happy want to welcome you all to be here in this afternoon session, and I want to congratulate the team of Obstetrics and Gynaecology department for coming out of their comfort zone and taking a bold step to organize a program in the last 10 days of Ramzan or Akhir Ashra. Very well defining to speak. This is the Moses drawing. We know that the evangelists are at their lowest ebb, and to give such a bold step to come out and hold to the ground deserve all the praise and commendation for all of this holy work. Thank you very much, sir, for holding this to the ground. Now coming to the ground, medical-legal issues, OBG. Basically, I say that this program is not only relevant for the OBG department, but it's a very comprehensive program and it's a very broad spectrum program which encompasses almost all the clinicians. We all are clinicians, and when we go into our medical practice, we tend to mistake some inadvertent mistakes. It's very common to happen. Although we know that competency has no substitute, but still, when we are about practice, we usually make some mistakes. And sometimes, these mistakes, we have to pay a lot for them. Especially in the backdrop of the environment when the consumerism is growing on and consumers are aware and oriented about their own rights. So it becomes very important to be conscious and oriented about those that are able to practice. Now, as I said that competency basically has no substitute, so we have to be confident about our own profession. Especially when we are going for some kind of operation, we have to take the consent of the patient, and we have to keep the patient informed all the time. We have to keep him aware and informed. It's very important that we give treatment completely. There should be no mistake as such. We have to treat the complications, and if anything happens, it may do out very largely, and it may have very consequences on our budding and blooming and flowering professional career in the beginning. I had my own example. Yesterday, I had a brush some kind of event when I was working in a hospital there in around 2000, year 2000. There was a patient who had a fighting and a brawl outside the hospital. He had a patient bone with the head and was running for feces. He came directly to the hospital. He was drunk also at this time. So we had to stay the patient, but it was not breaking to at that time. He started fighting with us. Police was partying, he was apprehended and taken to the police station. He was beaten there. And the next day, I got a call from the police station that I have to be there and have to register my statement. So I was fighting to the court because I had no knowledge how to proceed about all these events. So I was completely terrified at that time. What to do now? Whether it is calling me the station, I don't know what to do. So basically, knowledge is not. When we do not have knowledge, we do not understand how to proceed about an event which has happened in the hospital. All these events, by my luck, my auntie was a very emotional person, and I did diffuse the situation. So everything was resolved at that time, but I had very terrible sleepless nights. I mean, I was the brink of losing my job. I thought I should not do the job anymore because something will happen in the future. So we have to be informed ourselves that what are the laws and regulations that operate us. So I said that knowledge is and this will not talk this about this. That how we have to handle all these situations. Because law department is basically related with the child birth. But then I have to very doctors say that the maximum number of deaths might be not achieved. But all these patients were on their slightly down in their ages. They were the citizens and they were in your twilight zone, so there was more human right. But if you are related with somebody, a life which is coming in the world, there is maternity there, and something untoward happens, that there will be a lot of ill consequences because of that. So you have to be more vigilant. And whatever you do, you have to be very careful. So in a slight mistake, may become more difficult, mountains of moving. So I think this program will shed light on all these issues. And I expect it basically this whole to be completely full, which is actually not till now. It's very broad spectrum, which is cover the multi-dimensional issue, but all issues which are pertinent related to that intervene or hijab and all other departments or commissions who are related with these practice. So I hope and wish this program will be will increase our knowledge and it will increase our knowledge and of course your attitude towards the practice and it will give a risk-free environment or tension-free environment when you will do your practice. These are very few words from us, I think.
Sir, for a valuable insight. Now it's time to present the award for the workshop conducted on 24th March on OD ethics. I kindly invite Professor Nasir to come up on stage and facilitate the winners. Winners are Madhu from the first year, Department of Medico-legal from Amaraze Niswan, Sada from first year. From first year, it's by far. Now I call Saman Fatima from second year, Department of Regional Compliance. On behalf of Saman Fatima, Commission begins. It's my glory to invite first lecture of the day, Professor Niswan on the stage to share her profound insight on ensuring informed choices, the importance of consent form in healthcare. And please come on the stage.
A very good afternoon. I take a moment to keep all of you awake this afternoon as we had our presentation for the workshop on OD etiquettes. Similarly, we'll be having posters after the completion of this program. Those understanding well and scoring the highest will be awarded with 3 awards. So be awake, vigilant, and learn more so that you can perform your posters well and take awards. One of the 3 taking awards this afternoon. Thank you.
I Professor especially and the Department of Medico-legal from Amaraze Niswan.
Announcement, I thanks Professor Sayishana, Director, NIM. His acquisition is not available to the campus. So I thanks Professor Nasir Abdul Nasir Ansari, sir, the in charge director of NIM, for providing us the permission to conduct the CME or medical legal issues in obstetrics and gynecology. So the topic which is assigned to me is importance of informed consent. As you all aware that informed consent is the basic fundamental principle in a healthcare that ensure the patients understand and agree to medical procedures that treatment provided to patients. Basically, informed consent with respect to patient autonomy, promotes the transparency and uphold the clinical medical practices. The consent form is one of the most important ways to document your respect to the patients. So, a good consent form required in clear terms the counseling process of treatment. It is not a snapshot, but it is a continuous process. Documentation of the every aspect of the patient care, including that of obtaining the consent, is critical to the protection of the medical practitioner. That's why you have to fill the consent form completely. An incomplete consent form is considered as not documented. One thing you should remember that the what is not documented is not done. So please try to fill the consent form complete and it should be filled properly so that we are able to maintain the documentation and we are able to save the practitioners from it. So when you come to the consent, basically consent is defined in the contract act 1872 as two or more parties are said to consent when they agree upon the same thing in the same sense. So it's sort of agreement between the two parties. So before trying to have a look on the consent, you should know what is agreement and what is contract. Everybody knows this is sort of a communication between the two parties. Whereas contract again is an agreement enforced by the law. So every contract is an agreement, but all agreements are not contract. Like for example, I have promised to my colleague that I will arrange the marriage party. It is considered an agreement. But unfortunately, from some unavoidable circumstances, I failed to attend the party. It doesn't equal that we know it improves but we can't keep on the rest of the contract. Okay. So who has to give the consent? Basically, both parties have to involve the consent because it's not agreement between the two parties. Who should be major? The age should be above 18 years and they should be mentally sound. If the patient is a minor or she is a mentally, the guardian has to provide the consent. And the consent should not be provided under the effect of any sort of medications, anesthesia, or intoxicating substances. And it should be free from any sort of force. Then consent should not be obtained by force. Consent should not be obtained by any sort of force. Any sort of undue influence, any sort of fraud, or any sort of misrepresentation that is false understanding of the agreement between the two parties, and the one party is forcing the other party to have a contract. Similarly, mistake of fact in law, mistake of fact is the cause of understanding of factual situation. Say suppose someone has taken the other person's belonging, thinking that this belonging is lost, and that's considered as a mistake of fact. There is mistake of fact. That is false understanding of the law itself. Like what in the state is illegal in certain areas. Similarly, so such suspicious consent should not be obtained. Implied consent. Implied consent. Like patient has come to you for consultations. So you have to examine the patient, there is no mistake. And you're not providing any sort of treatment, you're not doing any sort of procedure. That is considered as implied consent. So implied consent we have to do with examination without taking any sort of consent from the patient. When you are doing any sort of procedures or treatment, then you have to take the consent. And the implied consent of all. So here, after the examination, patient is asking, they have got no evidence. For examination, doesn't require any consent. Similarly, I go to the patient's why the temperature degree on person, you not have to consent. You can examine the patient without any consent. Let's see what is the informed consent. Informed consent will be more common, mostly written. It is the consent between the patient and the attending physicians. So the patient can able to understand treatments, its consequences, its risk and benefits, alternate options, offer understanding the things that the patient will be enrolled in. So the reason is between the consent in requirements, whereas if normally there's elections, all consent should be taken from the partner person. So informed consent is considered mutual communication between the parties, the patients and the attending physicians, so the patient can able to be the orders. So this is about the informed consent where the duty of physicians to explain all the consequences, benefits, and alternate options available for the particular patients. Decided to have an informed consent. So here, this image shows that the surgeons have conducted one surgery according to the particular patients. Now they want to do better study. What is involved labor with patients, take the consent of the study. And also you should remember that at a time you have one consent for one procedure. If one consent you can't do the one procedure, please remember this. So that's why you know you have to take the informed consent by inserting the property and you just you have to take the consent. You have to take the consent for hygienic stay. You have to take the consent for burial and repair, instrument and deliveries, and you need to have a separate consent for each deliveries. And definitely high consent has to be taken. We inform consent now. You may not take the consent if you are doing the examination. If you are doing the examination, you have to have the consent of the patient. So the informed consent basically includes the nature of the treatment, what are treatment to provide to patients, whether it's medical treatment or surgical treatments. You have to explain all the risk and benefits of the particular procedures. You have to explain to the patients in detail about all the information available, and you have to inform the patient whether they have any words to create the particular procedure or the treatment. The patient is satisfied with all the understanding the patient is able to study the process. So this is the process of the informed consent. So the patient will receive the informed consent form, then she will read the informed consent form, and she will able to understand the information provided in the informed consent form. Then she will ask the what is the legal decision. And once the patient has been satisfied with all the required documentation, the child is informed consent form. Before they should be able to participate in your study for the child. So basically, the informed consent is the process where the patient will agree to the post-medical treatment on understanding the risk, benefits, and alternate options. So what we have once said that informed consent is required for treatment medical procedures for getting years to the family abortion. Your years here also you have to take the consent, and you are elected and you need to have the consent. So there are many consents. So what is the key elements required for informed consent? Disclosure of information. You have to provide the complete information to the patients regarding the procedure or the surgery or the treatment which you provide. And patient should be able to understand the information And the information has to provide the patient in simple language, the patient's language, easily. And patients should have the capacity, decision-making capacity. The patient should think of the status of the body, and she can able to provide the consent. And what is the consent? They can not, consent should not be very close. The legal part of this is basically the consent is for the maintain the patient's choice. Patient's right is to maintain creates the medical malpractice, medical condition. Where the medical malpractice reinforce the patient already have to maintain the properly. The compounds that inform consent are explanation of the muscular treatment, discussion of the risk analysis. You have explained all the options. There are the challenges located in informed consent, especially the language and interpreting challenges. Or the patient's not the language cannot speak. Or the patient can understand the level of power. And if the patient can the language or situations as a situations. In some cases, we are connected to the serious section. And unfortunately, we might say, if they are not in the same part, we have to set so the next time is for informed consent, use simple and legal language. The patient can able to understand properly. Provide the verbal explanation. You have to give sufficient clarification for the questions and any sort of discussions. And you have to document the consent properly. And ensure the patients have participate voluntarily without any rules. There are institutional considerations like in case of changes in the lines, you have to take the consent for the parents in the garden. The patient is practically is required. If the patient is speaking non-local language speaking or irritated person insists to have to be the translators or the head of the patient is to get back on the patient understands the particular situation the patient is able to understand. Whereas in case of elderly or pregnancy in such cases, SRT has to be given to the patient so that the patient can get assistance with the able to speak on that. Again, specific consideration that if the patient is unconscious or the patient doesn't have capacity to be the consent, then the decision has to be made with the patient as dangerous physicians. Because the patient is able to or any sort of medical emergencies where immediate people is necessary to see the life of the patient, you see or the patient is being considered. You have calculated the cesarean sections. The patient has severe bleeding. You have to perspective. In such cases, in such situation, it is urgent because you have to save the life of the patient. Whereas the decrease in contact diseases, some people may be married to the problem. Initially, in fact, COVID-19, because we have so all office have been informed to have the vaccine so to meet the emissions. There are ethical examples in informed consent. The patient who is treated. The patient that is treated, the patient that is treated. They don't study. The patient has been the consent of the study. They know study. So the process will guide respectively patient following with ensuring the best medical outcomes. Before they do it, they make this information before disposal of the suppose if the patient is subject to the carcinoma, they are supposed to tell the patient they don't have the cancer. They have specific conditions. Similarly, on the basis of the answer, the religious needs the patient linked to the family members to be the consent. In case of life decisions, especially not disciplinary order, this is a legal document that all are expected not seek for certifications if the patients retail and part is not motion. So that's why in all the right decisions, you have to pay attention. Regarding to decide which is better or is of consent based upon that he has the consent and consent was completely given it should not be diagnosed. The consent was attached to the procedure of treatment proposed. Because that if you were talking about the patient, say like we have decided to perform this technical the patient is having finite diagnosis. But you open the find the patient is having like alternate one is also permitted. And you want to perform the state only on the other domain also without taking another consent for another procedure. One thing you should remember is one consent for one procedure only. If you are performing the two procedures based on one consent is considered evidence and the doctors can have legal. The consent must be informed. You have to take the consent, adapting for all procedure patients, explain all the problems of the procedures, and then you have to take informed consent, whether it's oral or the this whole criteria of the valid consent must be made irrespective of the consent is invited or oral consent. The simple sign of the consent form is not listing consent difference from valid consent. This way, the proper documentation of the consent is more important. Documentation, if you are not documented, this you have not done. But this the duty of the provider to explain all the facilities of the particular procedure to the patients and the patient then has to do the response regarding suppose you are going to patient without report you have a response. And you have to explain that the patients may have blood reactions also. Okay, the patient is waiting, then you have to do that. Okay, and the providers not giving the materials to the patient, they will have the legal issues. So it's mandatory to give the all spare all materials to the patient before performing the exam procedure or the treatment. So patient have capacity to either give the right to consent or withdraw the consent or refuse consent, even if the refusal without the treatment may not so as government no operations, things of treatment implementation without your patients. You should always remember that you are not forcing the patients to give consent for the procedures or the operations of the treatment what we are going to provide to the patients. Which all we have to maintain the patient's right here. The only exceptions are the emergency, where the patient lacks capacity. In that circumstances, the patient's consent is considered as a resolution. So the consent to the proposed operation procedure or treatment must be obtained from the patients, and the patient's lacks capacity, the patient attendance has to give the consent. Where it refuse to engage in the legal actions against the healthcare providers, irrespective of the patient's outcome as a result of the procedures. So what is the basic difference between the consent form and informed consent? Actually, the consent form is a legal document that ensures the patients are fully informed about the treatment options or the procedures and voluntarily agreeing to enroll in the study or to have a particular medical procedures for the surgery or the treatment or research study. So that's why it's considered a critical component of ethical and legal medical practices. Whereas informed consent, basically informed consent is a process where the person is provided with all the necessary information related to the particular disease or the procedures or the research. And so that they can be able to make informed decisions whether to proceed with the study or not to proceed or not with the study. So it provides again a complete legal practice. So this is an example of informed consent to patient consent law. The informed consent, here the all details about the study, research study forms, like based upon the study, incidents and prevalence, treatment options available for this study. What are the consequences if the disease is not on time? What are the treatment options available for this disease? And what are the treatments which you are going to provide this disease in particular patients? How are the treatment has to be continued? How frequently the patient will be followed? And what we observe in this particular study? Once the patient has been understanding this study in detail, then they give the consent by signing the consent form. As I told you, the patient, the one consent for one procedure only. This creates a one case scenario. A surgeon is performing an operation on the colon or colon cancer on the 35-inch colon to 8 patients. The patient has given the consent for the procedures. During the procedures, the surgeon was concerned the patient's ovaries and the vibrations partners to abnormal. So he requested the gynecologist who attended the OT and advised on the patient's condition during the operations. The gynecologist considered that the vibrations and ovaries are abnormal with multiple cysts and there is a presence of human microcyst in the virus. So this is the procedure to remove the patient ovaries and vibrations during the same procedures where you are doing surgery on the colon without taking the patient's specific consent. The surgeon thought that the patient knows the vibrations so this will remote at the right time, so the patient is already in the OT. So they have decided to perform the procedure that is a removal of the ovaries and vibrations. So was the surgeon justified? Surgery what was done justified? No. Because the consent the patient provided was only valid with respect to the colon surgery. Patient was not given the consent for the removal of the ovaries and the vibrations. And the surgeon has removed the vibrations in the ovary without the patient consent. He could potentially be guilty and it could be called as a negligence. That's why the patient must provide specific consent for each medical procedure unless the circumstances are legally authorized exception in levels such as emergency. So that's why the court has ordered the particular medical practitioner to pay compensation to the patients because they have undertaken the surgeries without taking the patient's specific consent. That's why it enforces the importance of ensuring the patient's specific consent. So one consent for one procedures only. With one consent, you are not supposed to do the multiple procedures. So here you can see able to see the consent forms, but it was incompletely filled. So incompletely filled consent form is considered as not documented. What is not documented is not done. So you have to fill the consent form in details, including the patient's name, age, time of the procedure, time of the surgery performed, general anesthesia, or spinal anesthesia. Everything has to be maintained, including the simulation of anesthetics, surgeon, assistant, everything has to be maintained in the consent form. The sample of the consent form for an activity. This is a consent form for the surgery of the NIU and consent form for the anesthesia. All details has to be incorporated, including the patient's name, age, CR number, OPD, IPD number, diagnosis, along with the anesthesia, type of anesthesia, signature of the anesthesia, anesthetic, sorry, then date and time, everything has to be maintained in details. So I come to the conclusions. Informed consent is a crucial aspect of the medical healthcare. It empowers the patients, protect their rights vested in the doctor-patient relationship. Healthcare professional must ensure the transparency, clarity, and respect in the consent process. Take-home message: informed consent is more than just a legal requirement; it is a cornerstone of ethical medical practices. It empowers the patient to make Inform system in the facility, the patient will identify the safety factor and their outcomes. Survey, this is a description appears to be a high-step consent form for an experimental notification purpose. The crafting of this was the hard objects we want to be considered as what is involved. One thing you should remember that there is a different consent form and different procedures. With one consent form, you are not supposed to do all the procedures. Like there is a different consent form for the activity, different consent form for operative procedures, different consent form for abdominal anesthesia, and all surgeons have a different consent form, and that has to be maintained. But unfortunately, we have one single consent form, and that is all we are applying for each and everything. So it's a normal thing if you are this or whether it's a system. We have to prepare the different consent form for the different procedures. Thank you.
Thank you for updating us. It was an impressive session. Now, I request Harish and Shivani sir to present the one of the executive ma'am. Please, ma'am. Now, we move on to special movements as we proceed with the moment of presentation. I would like to invite Professor Abdul Nasir Ansari sir to please come on forward and present movement to Professor Ismail Shamim ma'am. Now I request Professor Abdul Nasir sir to present momento to Professor Ismail Shamim to Professor Rajat ma'am. Now I request sir to please present momentum to Professor Rajia Bikman. Now, I request sir to present memento to Dr. Kausal Fatima Firdous.
What was in the yeah,
Now, I would like to invite Professor M.K. Shirvani sir, Harish M.K. Shirvani sir, to present memento to Professor Abdul Nasir sir, Charge Director. Moving forward, I would like to call our second speaker of today's event, Dr. Manjunath Sir. Sir, kindly come on the stage.
I extend warm welcome to all the participants and delegates. First of all, I would like to thank the head of the institution, Director Sir, Dr. Abdul Nasir sir, for giving me an opportunity to be here and present this topic and HOD Forensic Department. Uh, Actually, this topic comes under Forensic Department. We are not trained to handle the case in the court, but still, I would like to enlighten few things for the budding doctors, and it will be definitely helpful for their future, I feel. And some of the slides are downloaded from the website, so I sincerely apologize for that. Thank you very much. So, if you closely look into the litigations are the problems where doctors has to face in their practice. Many problems are there to try to see. Most of the problems are attributed for the obstetrician gynecologists. In the running race, they stand first. So we stand first in terms of facing the problems. Why? Because everyone thinks that the delivery is normal. It is not abnormal. And changes in the pregnancy is physiological, it is not pathological. So they say that when breast normal हो सकता है तो हमको क्यों नहीं हो सकता? You can't give normal delivery for everyone. We know there are certain things where they have to face complications. So why not normal? When they come and ask you, you have no answers. And you say pregnancy is a physiological, then why are you explaining so many complications? So we don't have answer for this. Now let's see in few slides how and what we can do. Okay. Now if you closely see, when a patient comes and sues you in the court, you can't tell the judge that I don't know the law. Nobody has taught me during my medical course. Ignorance is not an excuse in the court of law. The judge will ask you, have you gone through the acts? If you closely see the amount of acts present in our law, if you see in surgery, orthopedics, very less. But out of 150, if you see, many acts are based in only the obstetrics and gynecology because we have separated into obstetrics, gynecology, infertility, laparoscopy, urogynec, lot of specialties are there. Each one, if you put 2 to 3 laws, PNDT, NTP Act, so many. Unfortunately, in the parliament, none of the legislation or constitutional laws protecting or supporting the doctors have been framed so far. So I request all my doctors to have a prevention way of that is the only way to cure. And once you get into the trouble, there is no excuse. You have to face the code. Okay. Now, in South Indian language, we always say that Vaidya Narayana Hari, that means the doctors are like God, they try to give you life. Gone are the days they were consisting, and now they only call us by two things. One is the sinner, and they always look in terms of killer. Last one. Sorry for the slides. Okay, so nobody will bless us with good things. They all come with whether he's going to kill me or whether he's going to do some problem to be complications. So they come with this attitude. This was some of the paper clippings I have taken from Ahmedabad. Now the curse and go is okay, we can manage. But now the extent has gone to such a way that they started beating the doctors and even up to the extent of killing us. For them, there is no section 303, 304, nothing. But if we do something, yes, they put under criminal law. So today Indian doctors are isolated, they are isolated, nobody is going to support us, and we are always vulnerable in our practice. Okay. So why the litigation is happening? Litigation are happening because we are not communicating with each other. If you see the litigation problems, it is always, if you see 40% of the litigation is between the doctors. So we doctors are enemies for another doctors. So because we are not communicating, the doctor who sees a patient may not complain about another doctor, but the facial expression of the doctor itself is he will see the open the reports and see ऐसा क्या क्या oh such a that's enough. They don't have to talk anything about us. The patient will see us in a different outfit. Why doctors may stand after seeing the patient discharge somebody. So the approach to the patient is also very important to tell you. Okay. Now, these are some of the laws which are pertaining to the Austrian and practice. Now, Birth and Death Marriage Registration Act. Now, birth and death registrations, all that. Now, when we studied, the death certification was totally different. What do you mean by death at that time? Patient is unconscious, not breathing, no pulse, pupils are dilated. This itself was enough to satisfy the death. But today it is not like that. Today, if you want to satisfy someone, you have to literally take an ECG and show a flat line and do an EEG brain and say that there is no activity in the brain, and also take an ABG and record that the oxygen levels are zero or carbon dioxide are high. So many things are there. And also do an echo to see that there is no cardiac mobility. So the technology has developed so much. We can't say that today the scientific death has become totally different. Okay, and even though patient is having good heartbeat, still we declare death today because of the transplantation rules and regulations. That's called brain death. So brain death is a death certified for the patient to extract harvest the organs because of the time limitation. So the time limitation is to harvest a kidney. It is about 24 hours. We can't wait for the patient to arrest and then cardiac standstill to harvest the kidney. Similarly, for heart and lungs, it is about 3 to 5 hours, and for liver, it is 12 hours. Remember, for kidney, it is 24 hours, and heart and lungs are the shortest, 3 to 5 hours. Medical termination of pregnancy, yeah, I would like to tell you few examples in between. Now, when I started my practice in 99, we came across a case in a private nursing home. A doctor has taken a consent and did an MTP. So, I'm sure this institution, we are not doing MTP here, but those days it's called as a DNC. He wrote it as a DNC and did an MTP. At the time of doing, patient has arrested and death has to be declared. But to declare the death, we started searching for the attender. Attender has vanished, and the doctor doesn't know what to do. So nobody came to collect the body, and body was in the nursing home. Procedure was documented as DNC, and no attenders were there at that point of time. I'll tell you why it's important. And after about 4 or 5 days, they came to see a newspaper, this one, saying IAS officer's wife was missing. So they started searching where, and our body was there in the nursing home. Now, who is negligent? Attendant, doctor, or the situation? Who to blame? So, When such a thing happens, you can't keep the body in nursing home for 3 4 days to see someone comes and climbs. So what we have to do when sudden arrest occurs inside the hospital, how to approach? Transplantation of human organ, I will report mental health act, preconception, prenatal, preconception, prenatal act, I will tell you a best example. See, nowadays, this act is very good to prevent female infanticide thing happening because nowadays they started manipulating the sex before consumption. How they can adjust the sex because we have certain tests called amniocentesis where you do DNA analysis by which we can know whether it is a boy or a baby. So before the baby grows up, if we have full-fledged embryo on the fetus, we can still recognize the sex of the baby. That is preconceptional. And postnatal diagnosis, I don't think we have to explain this. You all know ultrasound and many other gadgets are there to pick up and give a diagnosis. Now, why this act came? Because when compared to the sex ratio between the male and female ratio was dropping down. And for every 1,000 males, it's around 923 female ratio. Thanks to the act which is protecting the sex ratio. Uh, Assisted reproductive technology, ART bill, yes, this is one of the latest 2014. Now, ART therapy says that there are a lot of, madam was explaining the consent form. Now, ART itself, there are about 7 consent forms to be signed. So, if you closely look, form A is for registration, form B is for approval, that is the government approves that this can be infertility center. Form C is for rejection. So form B is for patient uh, permission to do procedure in a genetic lab. It's for genetic counseling. And F and H are for invasive procedures, and surrogacy there is a separate form. So for each and every, right from egg pickup to embryo transfer to the surrogacy, there are many forms. Why I'm telling so many forms? I tell you, one of the infertility center, the gynecologist or the infertility specialist transferred 4 embryos. Now, after transferring 4 embryos, the patient conceived, and for good luck or bad luck, we don't know all the 4 embryos become fetus. So it is called quadriplex. And patient walks to the gynecologist and says, I expected only one baby. You are giving me 4, I don't want. Now what gynecologist has to do? 3. So if she has taken consent for 4 embryo transfer, she would have been protected that time. So consent form is very important in case of ART treatment. Now many times, believe me, I have my own personal experience. A young couple from South Africa landed in the infertility center, conceived, and happily they got a boy baby. But her boy baby was fair looking, handsome, and father and mother were, yeah, I don't want to make color differentiation ratio. So that was the issue. And third incident, there was a litigation of forefathers' property. So where they claimed that the son will be the next legal head for the property. Now when they checked his blood group, mother was A, father was also A, and baby had B group. Now, when father is there, mother is there, how can baby can have a B blood group? That means something donor embryo, a donor oocyte, a donor sperm were given. So that will not stand in the court of law unless there is something written on the case sheet and at that time consent was taken. Now parents will directly sue the fertility specialist. This is not my baby, or somebody else baby, they exchange it. So how a fertility specialist will protect? It's very difficult. It's very difficult to come out of the case. Okay, there are many, and I could give a number of examples for infertility problems. With this introduction, I want to tell you why there is a problem. So There's a growing concern about the relationship between caregiver, that is the doctors, as we care receiver client, medical practice regarding the mutual trust and understanding. So this forms the important aspect of the medical legal. There should be a kind of a trust and understanding between the doctor and the patient. So we have to develop such a rapport with all the patients. Now, due to the growing expectation of the society, what are the expectations of the society? I'm telling you. Now, these are the expectations of the public. When they come to you, the day they walk in, they tell all diseases are cured in one day. Can I admit and go by evening? What answer will you? Will I deliver now itself or today itself? By the treatment of the choice, you say cesarean, they will say no normal. So they make the choice and you don't have choice. So what we have to do? And free of cost treatment. Anyway, you are removing the fallopian tube. Why don't you allow gallbladder also to be removed? Which is major? Gallbladder is major. Minor surgery free of cost, they want another surgery also to be done. Okay? In the hospital of the child was already told you. And at the time they like, yes, they will put you on the top of the world, praising you at the time. And end when you give the bill to them, you should see their facial expression. All the diseases to be diagnosed at once. You told me I have only uterus infection. Why didn't you say that I have diabetes also? So one of the surgeon did a incision and drainage for the pus. That is the duty. He did it. He asked the patient, please, your wound is not having, or can you check the blood sugar? Now, why are you suspecting me? My sugars are normal. Okay. Then after some time, what happens? The food infection becomes a sepsis and he has to land in ICU. Then he goes to court and sues him. Doctor has not told me, has not diagnosed that I have diabetes also. He was unnecessarily making bill for 3 weeks, doing dressing and removing, doing dressing, putting ointment, changing antibiotics. Now, who has to protect us? Now, with the modality of their choice, that I've heard and doctors say what they like. Because if they are kith and kin, we go to the consultant and say, please the question. Why don't you do it, sir? I'm also a doctor, but I will support my relative rather going with my colleague. Now, doctors at this, nearly 50% of the violence is happening to closely look into ICU and surgeons, that person operated case. Now, kith attendance of the patient, many times you see, many times the problem creator are not the patients. They will be very happy with your service, but their relative will not allow you to stay with them. So kith and trickings are the troublemakers. So if you come across a patient attended in the hospital, maybe their second relatives or third relatives, please sympathy with them because they are the problem creators. Now, this standard definition for medical legal cases. Now, what are the duties of the doctor? Doctor knows certain duties which has to be delivered. Now, when a patient walks in, as Madam mentioned that you have to mention the time and place and what procedure they have done and what you are going to explain. Now, if you don't document all this, then you can be negligent for that. Now, first thing in the court of law says the doctor-patient relationship is most important. When they establish this, then only the law goes forward. Now, failure to that, the court expects the doctor to do certain norms. Court doesn't expect you be like a big consultant, government is give full care. No, court expects that you should be an average physician, average surgeon, average gynecologist who can deliver minimal care without harming the patient. You rather than causing the chaos in the treatment. So we don't have to be extraordinary. Just know little knowledge and little care. And if you don't know anything, please don't do anything. So if you out of wisdom, if you try to do something, then you will get into trouble. I will explain you. Patient comes to a doctor and asks for MTP and just 6 weeks. So doctor will say, yes, I will do it in easy way, don't worry. While doing, the doctor perforates the uterus and causes intestinal perforation. Now, case goes to the court. Court asks why this complication occurred. Doctor says it is the blind procedure. While blindly doing it happens. Now, judge asks only one question: show me where it is written blind. None of your books write it is blind procedure because blindly you can't do anything. You are a doctor, so you are opening eyes, looking at and doing it. So with over enthusiasm, you try to do something, you will get it done. Malpractice, I'll explain later. The physician must inform the parents about genetic counseling and prenatal diagnosis. Now, this is the first part. As you all know, nowadays the latest is anybody is going to get married. Many people are there. So before marriage, what is there? Premarital counseling. Without counseling, you can't marry someone. That is the law in the Canada. So you have to know. Likewise, we have pre surgery or with the pre-genetic counseling, where you bring them and explain all the possible ways of treatment. And next thing is patient privacy. So that the court also expects you to be given patient autonomy. You can suggest a treatment, but you must supposed to tell alternative methods, whether it be treated medically or surgery is the technique, whether there are any alternative. It's very important. And the patient has got the freedom to select what they want. Okay. So no information was obtained by the counseling and screening should be disclosed to third party without patient authorization. No. When we are doing counseling, there will be a third party, either in the form of husband, mother, father, in it forms important thing to take signature from the witness signature from the third party also. Now, types of legal threats in obstetric practice. Now, what are all threats we can get? There are some claims and frequent sometimes. Now, it can be perinatal, maternal injury, or both. Now, perinatally, we can come across stillbirth and neonatal death. Now, what happens for stillbirth, neonatal death? A mother comes to you with pregnant mother comes to you with reduced movements many times, and you try to do the tests. All the tests comes out to be normal. Now, with the question of the gynecologist whether to continue the pregnancy or deliver. Now, depends whether its viability is not there or not. Now, with the interest, you give them a choice to at least postpone for 1 week or 10 days, depending on the situation. But in the event if patient worsens, who is the responsible, doctor or the patient? So that forms are very important. So whenever you come across such issue, I advise to take a secondary opinion from some other gynecologist so that nothing is involved in your pain. Okay, that's very important. And brain damage of the baby, in the event of postponing the pregnancy, child develops some kind of hypoxic damage at the time of delivery, then they can sue you. So also involve the pediatrician and tell them that this baby may deliver prematurely, can have problems. In spite of explaining to the mother and the relatives, it was important to have a teamwork, involve the pediatrician also. So that tomorrow litigation we will come for help, we will tell, yes, it's very informed, we have kept everything ready. Okay? So that's very important. And here I'd like to tell one more important thing. We do day in and day out hysteroscopy procedures nowadays. Now, one place in north, there was a sudden arrest by doing hysteroscopy. Now, sudden arrest patient went, case went to the court. Court asked, was it a common complication? Surgeon said, yes, it is a common complication. Now, what is the cause of the death? It is pulmonary embolism. Pulmonary embolism is a commonest complication. Yes. What is the treatment? Treatment is a ventilator. Did you have ventilator? No. Then how did you do the hysteroscopy? He said, yes, that is the procedure required. Now, who is going to protect you? Next, the same case went to the higher court. Here, doctor was uh, punished for the doing hysteroscopy. The same case went to higher court. Higher court, there was an argument. Finally, they said that 4 hysteroscopy is a daycare procedure can be done in the clinic. That was the only line which was there. And the concerned lawyer has to argue in the court saying that it is a daycare procedure done under 4 hystoscope. All the clinics will not have ventilator. So that is the only thing which saved the gynecologist. So finally, case was dismissed. Pulmonary embolism can happen anywhere. So ventilator should be kept ready. It is a bigger institution. And cystoscopy was a minor procedure. It is a daycare procedure, can be done without anesthesia. Vaginal breech delivery. See, when I was studying till I think, if I'm sure, 2000 for breach, you have to give normal delivery. Thanks to the amendment which just came 2003 onwards, it clearly said that all breech deliveries has to go for cesarean section. Earlier, before 2003, if we tell someone to go for cesarean, then we used to swerve in the code. So breech delivery always has to be gone to cesarean section. So this amendment happened 2003 onwards. So the practice also changes according to the law. Now, maternal trauma, maternal injury, we'll see later. So they all come under obstetric threats and instrumental delivery, operative delivery, anesthesia. Failure to provide standard care may again be either by act of omission or commission. That is what the code says. And then adverse outcomes of the medical care are often due to systemic errors. Now, when it comes to the systemic errors, I will tell you there is one important thing that have anyone come across materialistic law, meteorologistic law? I have not heard. Recently, when I was going through the net, only I came to know Indian Meteorology Weights and Measures Act, where they check the machines whether you are running in the hospital is properly calibrated and measured every year. So if it is not calibrated, they can sue a case on a hospital. Now, where we use the measuring instrument, weighing the baby. So when you wrongly weigh the baby and they goes to some other clinic and measures the weight of the baby, the difference in weight itself can lead to the court, and court has awarded 10 lakhs to the plaintiff. Okay, so this law, no one knows how we can check the equipments. So inadequate staffing, you have written the gynecologist has written 4 centimeter dilatation. Next, nurses notes same time returns 2 centimeter dilatation. Now, how will you protect yourself? So, inadequate staffing, your nurse should know what you are writing, and she also should write properly. If it doesn't match, then you are in trouble. Of course, in the theater, mock counts, instrument count, missing instruments are the mitigations. So, I am telling, if doctors get is not enough, you have to have a good staff and trained person in your theaters. There are few other cases also I want to discuss. One or two cases I will tell you right now. There is one incident when I was doing a case. See, pregnant mother came for C-section. After the delivery, the standard is to give oxytocin and methogen. Oxytocin was given, and after giving methogen, mother started complaining of intense headache. Then he thought probably the pressures might have shooted up. That is why she's complaining headache. So we started bringing down the blood pressures by using the amphetamine, and still she was restless, irritable. We gave some sedation. Patient was shifted to the ward. After shifting to the ward, she started becoming more irritable and irrelevant words. Then we had a doubt and we shifted the patient to higher center. Higher center people also observed and they thought probably it is pre-eclampsia, going in for eclampsia, and they started giving magnesium. After 4 hours, patient didn't settle down and they did a scan. They found that there was a intracerebral hemorrhage. So initially, the physician who saw in the medical college thought this case could be because of embolism and brain infarction. So he thought it is embolism and infarction. He gave heparin to lyse the clot, but already bleeding inside the brain wasn't because of the treatment at higher center. And finally, the case landed up in gynecologist problem. So how to protect when such things happen? So luckily, what happened? They did a craniotomy and they decompressed the brain. And after the recovery, they did a angiogram, they found that multiple aneurysms was there in circle of Willis, and one of the aneurysm has ruptured. This is not a gynecologist problem, but following methods in all the event occurred, so the blame came on the gynecologist. That is the one case issue. And second case issue I wanted to tell you, see, you can't do unnecessary investigation for all the patients. So whenever you are doing investigation, we have to support with the evidence saying that this is the problem, that's why I did this investigation. Now we have an habit of doing a painless labor analgesia. So we had passed a epidural catheter for a pregnant mother, and whenever she gets pain, we used to give a top of bolus of 10 ml of local anesthetic into the epidural catheter. Soon after giving that injection, mother used to throw fits. Now we are thinking what is happening when we draw, there's no blood in the catheter. We are placing the medicine in the right place. Still, mother is throwing fits. What is the problem? Now, second bolus was given. That time also she did conversion. Since mother was still in the labor, we had to shift her to the CT stand room and do the thing. Then we found a big brainstem tumor pressing and causing raised intracranial pressure. So already raised intracranial pressure, and every time you push 10 ml, 10 ml, 20 ml, 30 ml, that used to raise the intracranial pressure cause through fits. So here there is no problem with the gynae problem or obstetric problem, but still the obstetrician has to face the code. So this is the second incident. And the third incident I wanted to tell you, soon after delivery, patient was absolutely fine, but because of the PPH, she has to intraoperative placenta upgrade, I think, I'm sure. So bleeding was not stopping, they had to proceed with hysterectomy. Cesarean hysterectomy happened, and then the patient was absolutely fine. Uh, After some days, what happens, fourth or fifth day or sixth day, patient is about to discharge, patient went home and gynecologist goes on a trip to Goa, and she gets a call in Goa saying that your patient has come with abdomen distension. Now she has gone with her family to celebrate a occasion in Goa, she can't come back. She says, going to admit the patient, and they found that there was a bowel injury, patient had a fecal fistula, peritonitis, and she finished her holiday vacation and she comes back. At the time, so when she comes back and sees the patient is in a very bad shape with the ARDS, meconium, laparatory done, saturation is not holding, and after 2 days, patient dies. And attender of the case sues a complaint saying that my wife landed up in complication and the concerned gynecologist was in Goa, she didn't even come. Now, whenever such thing happens, it forms your duty to find out a trustworthy person, hand over the charge, and then go with your absence. So that is what the code of law says. Whenever you come across complication, you have to accompany the patient and see that the better care is given. If you cannot attend personally because of your family commitments, you can always have one more consultant in the hand, and you have to personally explain and hand over the case to the concerned person. That is what the law expects. So how to see, so many complications, so many litigations, how to prevent legal and ethical issues in obstetric practice. Now, only two things can protect you. One is communication, another one is informed consent, informed written consent. What do you mean by informed written consent? What all should be there? 6 points should be there. One is who is explaining to who, and what is the procedure, what are the other procedures available, what is the expected complication. You can tell up to the death, you can explain up to the death complication, but it has to be documented. It has to be, after all this, last few sentences saying that I am in a conscious state, and the gynecologist explained in my own language, and my kit and kin was there during the procedure. After saying all this, whether it is informed consent or a medical leave certificate,